My name is Aida Tinajero, and I'm doing my presentation on diabetes in Merced County. Diabetes mellitus is recognized as a preventable cause of death, and it can be managed and avoided with lifestyle changes. Merced County has a higher prevalence of diabetes compared to California. This is reflected in the higher burden on its healthcare system. In 2019, 0.8% of all emergency department visits and 2.4% of hospital admissions in Merced County were due to a primary diagnosis of diabetes, compared to 0.0% and 1.8% in California, respectively. A sedentary lifestyle plays a big role in developing type 2 diabetes. Physical activity helps the body use insulin more effectively. When you are more sedentary, your muscle cells don't respond accordingly to insulin, leading to insulin resistance. When the body needs to produce more insulin to manage blood sugar due to insulin sensitivity dropping, it leads to having pancreatic fatigue and eventually developing type 2 diabetes. Merced County cases. The age-adjusted prevalence of diabetes for adults age 20 plus in Merced County is higher than the state. Merced County is 8.9% and the state is 8.7%, but it's lower than the national estimate of 9%. Looking at diabetes in the entire Merced County population, 15.9% of residents have been diagnosed, 10.2% California, 13.3% in the United States. 14.6% of Merced County residents have borderline prediabetes, which is higher than the states at 4% and the national at 9.5%. Death rates in Merced County due to diabetes have increased over time and are higher than both state and national rates. Both California and United States age-adjusted diabetes death rates have remained stable. However, Merced County rates have risen 19.3% in the last 12 years. And I've included a diagram showing green is Merced County, orange is California, and the navy blue is United States. So Merced County has been higher than the states and the country since 2006. In 2006, it was 27 cases. Well, from 2006 to 2008, there was 27 cases. From 2012 to 2014, there was 28.1. From 2018 to 2020, there was 32.2. Demographics in Merced County. Black people have the highest rate of emergency department visits due to diabetes, 6.5 per every 1,000 people, followed by Native Hawaiian, other Pacific Islander people at 3.6, Hispanic Latino at 3.3, whites at 3.2, and Asian at 1.1. For diabetes hospital admission rates, Blacks have the highest rate at 4.2, followed by white 3.2, the Native Hawaiian, other Pacific Islander at 2.7, Hispanic Latinos at 2.1, and Asian at 0.8. Prevalence of diabetes in adults is higher in males at 9.3% compared to females at 8.5% in Merced County, which is the same pattern seen in California and in the United States. There are 5 major risk factors for diabetes, which are being overweight or obese. Excess fat can lead to insulin resistance. Insulin is the hormone that helps glucose from food to get into your cells for energy. Being resistant means your cells don't respond to insulin, causing glucose to build up in the bloodstream. 2. Having prediabetes means our blood glucose levels are higher than normal, but not yet high enough to be diagnosed with type 2 diabetes. It's like a warning sign to make a lifestyle change to prevent diabetes. Number 3, not being physically active. When you exercise, your muscles become more sensitive to insulin, allowing glucose to enter cells more easily. Number 4, poor diet can contribute to weight gain and insulin resistance. Processed foods, sugary drinks, unhealthy fats, and low fiber foods can cause rapid spikes in blood glucose levels, putting a strain on the pancreas. And lastly, number 5, smoking. It has been linked, but it is still being researched. It's believed that smoking can increase insulin resistance, cause inflammation, and damage blood vessels. Facts about diabetes. There are 3 main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is autoimmune, type 2 is related to insulin resistance, and gestational occurs during pregnancy. Number 2, over 537 million adults worldwide are living with diabetes, and the number is rising rapidly, especially in low and middle income communities. Type 2 is the most common. 90 to 95% of people have type 2 diabetes. It is often linked to lifestyle factors like diet, exercise, and obesity. 4. Type 1 diabetes is caused by the immune system attacking insulin-producing cells in the pancreas. It usually appears in childhood or adolescence, and is not preventable. Number 5. Common signs include frequent urination, excessive thirst, fatigue, blurred vision, and slow wound healing. Type 2 diabetes can develop gradually and go unnoticed for years. Number 6. Poorly managed diabetes can lead to heart disease, kidney failure, nerve damage, blindness, and amputation. Number 7. Managing diabetes is key and requires regularly checking blood glucose levels, especially for people on insulin. Number 8. A balanced diet, physical activity, and weight management are essential in controlling type 2 diabetes. Number 9. Gestational diabetes develops during pregnancy and increases the risk of both the mother and child developing type 2 diabetes later in life. And lastly, number 10. While there's no cure except for cases of type 2 remission, diabetes can be effectively managed with medication, lifestyle changes, and education. With this information, I have developed a program called Parents in Me. The program will target children aged 2 to 12 years old and include their parents. The program will be implemented in community centers with participation in schools and local parks. Some resources needed will be educational materials, sports equipment, healthy food supplies, funding for events, and trained staff. like nutritionists, dietitians, and physical trainers. The three major areas that the program will focus on would be number one, to promote healthy eating behaviors. Number two, encourage regular physical activity. And number three, reduce sedentary behaviors. Strategies and education for the program would be one, to focus on educating the parents in nutrition, doing food campaigns and providing cooking classes for adults, and doing parent and me classes to involve children. Providing community fitness events, doing daily PE classes, and providing after school sports programs. Educating adults and parents on the importance of limiting screen time, doing interactive learning tools, and having homework housework breaks. To be able to provide these activities in the program, we would need to advertise in the community to receive engagement. By increasing the interest and participation in the program, it will help educate the community in developing healthy habits from a young age to adulthood. It will help children learn healthy habits that can prevent diseases like diabetes, and it will help adults prevent, reverse, or manage them. An overview of the program. It- This program would consist of educating the parents and children to help prevent and reverse diabetes in the community. This would be done by creating a community program trying to focus on getting government, city, or insurance funding. It would be a program integrated in schools and outside of schools to involve the adults. The families would participate in parent and me activities like workout classes and cooking classes. There will also be individual sessions for parents after work and for children in after school programs. This would focus on nutrition education for adults and sports physical activities for children. There would be nutritionists and physical trainers for each department and a list of when the sessions would start for adults to sign up their children. Once started, it would be 12 courses covering all three aspects of the program. Once completed, they are more than welcome to take refresher courses or keep coming to the physical education courses, like if it was a gym membership. The goal is to make awareness fun and to help them establish permanent healthy habits they can do at home and for the rest of their lives. This concludes my presentation. Thank you.